So I'm here today with Luke from Paul Gough Media, and we've been talking with some of your clients.
Hmm.
We've been sharing some stories about workshop success and utilizing physio funnels. And I wanted to hear from you some of the things you've been hearing back from them, because there are still a lot of clients out there who have that fear of doing a workshop. Will anybody show up? Will I be able to talk if I'm in front of a group of people? I'd love to hear some of what you've been hearing, some of the buzz, and just your thoughts.
Yeah, absolutely. I think to take it like I suppose the highest level possible on this one is the first thing I can tell you is the biggest difference I've seen for the guys is going from an I can't attitude to I can to seeing it's possible. To have that thing, the product or the services to be able to actually sell and get belief behind it. I know obviously there's been a lot of success over the last few weeks. You've got Todd Houghton, Ken Cheng, all have had tremendous success with this thing, Ricky Morgan. And yeah, I just think the belief of I can do this and I have this thing that I can actually position for patients, for clients, give them an opportunity to be successful in what they are wanting to achieve and actually have the confidence behind a product to go out there and do it. I know if I was to think about my conversation with Ken before he went through with his workshop and kind of like getting to that point, Ken's always been a little bit nervous and a little bit shy sometimes. He's not been the guy who stands in front of the spotlight and does it. But I mean, just to see his face today, I mean, I was talking to him when I was mastermind call and I was talking to him to just see that smile on his face lift up from ear to ear, and see the success he's had for him and his business and allow him to become a much better business owner, has been fantastic.
Yeah, and Paul Hendricks had a great analogy. He said, think of a workshop as just being a group discovery visit. It's like, are you nervous doing a discovery visit with somebody you've never met before? You have no idea why they're here?
Yeah.
No, they ask a question, you ask questions. It's a totally normal thing. So that's exactly what the workshop can be. It's just you got multiple people. And the nice part about that is you're able to harness that group herd mentality, because all of a sudden Betty hears the story from Dave, who, he's had neuropathy for 5 years. He's been on gabapentin. He got to the point where he didn't want to do that anymore. And she goes, yeah, that's like me. And so it just really helps reinforce that.
Yeah, I think it becomes almost, if you want to put it this, like a tribe mentality. And I'm really hearing the words "it's possible." So, like you exactly as you just said, you've got Betty talking to Derek, talking to I don't know, Keith, Steve, whoever it is, of seeing the words. It is possible for me to get help. It is possible for me to see this thing, be successful, and solve my problem that I've always thought that nobody could help with. I think from the clinician side of things as well. That's the other thing. It's you guys talk about this all day long. There is a natural confidence that comes from the moment that you step foot out there and just start talking and know that you're in front of your people. These are, at the end of the day, your people. Like, they're your patients. You see them every day, every month, every week. And to know that you have got, like, you can do this. There is a possibility to do this. You've got a great thing to sell. You've got an opportunity to help people. Like, all those things start flooding in straight away to you once you say those first words. And I think it is just do the thing. But yeah, from the patient side of things, you're right. You're absolutely right. It is possible to do this. It is possible to get help on the other end of this, where I've probably spent 12, 18 months, probably longer, with something like neuropathy, thinking, I can't do this. Like, there's nothing for me. I've just got to grin. I've got to bear it. I've got to possibly talk to a few family members and tell them what's going wrong. But ultimately, there's no solution to me. And I think the biggest thing that, if you look from a patient side of thing to this day of what you've been able to do and how we've been able to help people with this, is they've now got an avenue out of this.
Yeah, and from our perspective, part of our package, we fly Dr. Collins to their clinic. So he's there in the morning. Typically, the way we set up the day, first thing in the morning, he's doing some additional hands-on fellowship training with staff. Then we tell the clinic owner, we say, schedule 10 or 15 of your most complex cases that you have been trying to figure out how to best help these patients. Because Dr. Collins has been doing this. He's been a doctor for a long time. He's been doing Stimpod for over 4 years. He has seen everything that's walking in your door. And so they do that. And then I say, schedule a workshop for like 1 o'clock in the afternoon, and schedule a second workshop for 5:30 or 6 that night, because you will have some people who work who can't get there for the 1 o'clock. You'll have some people who, want to be able to go to the 1 o'clock because they have to be home, to make dinner for the kids for the 6 o'clock. So it just gives you the ability to have those markets of different people. And then we give them the option of, if you want to add Saturday, we can talk about adding Saturday, because, hey, he's already there, and there are people who can't get there Friday at 1 or Friday at 6, but they'll be there Saturday. And so it really works out great, and it gives them that extra comfort level of, I'm going to have somebody there holding my hand for that first big workshop, and he just helps them crush it. And everybody, that he's gone to. Funny part is, with Ken Chang, Dr. Collins was able to drive there because Ken's in South Jersey and Dr. Collins is in Jersey. So instead of my having to fly him out there Thursday night, he just drove over there Friday morning. So it worked out really, really good.
Yeah, I think if I was to think as well, talking to these guys who are in our community who've used this, one of the fundamental things is having Dr. Collins there has been great, just as almost a backup, almost that kind of person that I can lean into, and that, like you said, I'm not doing it alone. And then the next time, obviously, they've got that confidence to go and do it. I think probably if I was to look at it as well and say the patients as well have really, really valued that as well, to have that level of expertise, to know you've got if you want to put it to the most British way, the cream of the crop, kind of right, the very best of the best doing it, who've helped multiple people, to have them around. So yeah, and I think it's always great as well for clinicians. That's the other side. It's easy for a business owner, obviously, to get behind something. Quite often, maybe a business owner can see the value of what they're doing. Sometimes the clinician of the team can be a little bit, oh, I've never used this thing, I've never heard, maybe I've never been taught about it before. So to have Dr. Collins there has been great for them. I know that speaking with Todd recently, his team were hugely impressed with Dr. Collins as well for being there, and just having that support network around them, just to be able to go, great, Todd, you've said this thing's going to work. You've said this thing's great. Okay, great. Let me speak to Dr. Collins. And I know from personally meeting him, obviously events and whatnot, he's a brilliant guy. So yeah.
Yeah, no, and he's fun, and he enjoys it, and the clinic enjoys it, and the patients enjoy it, because he really walks in with that confidence, knowing he's going to help every single one of the people that you brought to the workshop. And that's huge, because the people that you get from the first workshop that you start treating, now we encourage you, get some videos, get some case stories. Now you start building your own library of amazing outcomes of your patients. It's one thing for you to watch a video of somebody else's patient, and I know in the back of your mind, you're always thinking, is that an actor or is that a real person? But when it's your patient and you know the struggle that they have had and the pain that they have had, and all of a sudden you see them starting to be able to do some of those things in their life that they want to do, that's why you got into this business. That's why you got into this profession. And so to be able to do that, which is why my other little mantra for your clients is, you know what? The best way to improve practice income is to improve patient outcome. And that's exactly what, we're able to do, with Stimpod, and making people comfortable and confident using it, because it really, really works.
Yeah, I think it's as simple as proof of concept. It's proof of concept every time it's done, every time it works, whether it's Stimpod, whether it's a business owner running a workshop, it's a clinician using the machine. Every time you're building proof of concept, every time to go into the next one and have that confidence, to use it, to recommend it, to utilize the tool that's actually being given to you. Yeah, I think again, it's like you go back to it, and I don't think many clinicians are probably taught about products and services. It's quite probably manual. It's probably
And on a similar light, they're not taught about business either, which is why for them to find Paul Gough and to find you guys and the coaches, it's like, okay, they didn't teach me this stuff when I was going to school. And this is what it takes, especially nowadays, to not only be in business, but to really be able to thrive and stay in business, can be challenging for people. And that's why, you guys, Paul, as I say, Paul really walks the walk. He's not one of those gurus that's just out there, teaching. No, he's done it. He knows exactly what's involved in it and all the new things that he keeps coming up with. I mean, I'm always blown away, whether it's Paulo, whether it's, physio funnels, whether it's workshops. It's like he really is the right place at the right time for these clinicians.
yeah, I think there's a lesson to learn. It's not about doing anything crazy brand new sometimes. Sometimes it's just about listening. It's about listening to what the problem is or what the people need and what the business owner requires and being able to help and support them in such a way to do that. What does it look like? It happens for clinicians. It happens for business owners. It happens for us as well every time. We're always trying to look and learn for something new. So yeah, it's a pleasure. It is. It's fantastic to be a part of it as well and to be on Paul's team and be able to do these things. But yeah, I couldn't be more proud of what we've been able to achieve over the last, truthfully, few months with working with you guys and with Stimpod and physio funnels and obviously with the workshops all in the middle and giving people a pathway to be successful to do it where it probably wasn't thought possible. We've just come out of a session there we were talking about, and it was the big kind of lesson was reframe your mind from I can't to I can. And hopefully we're able to do that. Hopefully you've seen that. Obviously you've been around us a little bit now. I remember the first time meeting you in Florida, I think I probably nearly got disciplined because I think you nearly put me to sleep with doing the vagal stim stuff. You said, leave me alone, put him in there for 10 minutes on his own. And then about 9 minutes in, I think Paul walked in the room and I was like, Paul, I promise you, I'm working. I promise you. Yeah. But no, it's great to be a part of something like this and to be part of Paul's world, to be working with you guys. Yeah, it's incredible.
Great. Well, keep bringing in the new clients because we love working with you guys. We love working with them. And it just feeds on itself because they finally find a pathway to get what they want in their life. And everybody wants something different. Everybody wants to help their patients, but there's also the fact that they want to help their family. They really want to be successful. And some of them have gone through a lot of struggles, and you guys really help weave them down that pathway. And I'm happy to be a part of it.
Well, if it's what we can do, and I think it's very much it's what we've tried to create is a community of like-minded business owners who are able to help each other. And I think that if I was to leave it on this, it's get behind a jet stream that's successful and works and just see where it takes you. Because it's easy to do something and try and think that you've got to come up with something new and creative every time. There's few people in the world who will create something new and be the pioneer of it. The easiest way to success is get behind someone else's jet stream and say, tell me how you did it. Tell me how I can be successful. Tell me what the pitfalls and the challenges were that you went through so that I don't have to go through them and I can navigate them a lot easier. So if we can do that for people, and if you can do that for patients as well, I think there's a perfect harmony of a relationship. And really that's where most success comes from, not from trying to do something on your own, whether it's this or that. It's how do you bring the two things together and accelerate growth. So if we've been able to do that, brilliant. If we can keep doing that, even better.
Well, I appreciate all of your help and look forward to many, many years to come.
Likewise, and hopefully you don't get me fired with more vagal stim stuff.
Thanks.